Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
My name is Eric Jones. I'm a second-year fellow in Allergy and Immunology here at LA County, USC. The Allergy and Immunology Fellowship Program is a 2-year training program. There are 2 fellows, and it is roughly divided between 50% clinical time and 50% educational time. That's a mix of didactics and research. So the program, in terms of the culture, I would say is very tight-knit. It's a small program. You get to know the faculty really well. You get to know your co-fellow very well, obviously. You work very closely with the staff, and I think it tries to create a really family-like atmosphere, which is one thing that I was drawn to. I think the department does a really good job of trying to bring in people that are very friendly. So between both fellows, staff, everyone is kind of very friendly, creates that family-like atmosphere, so that's important. For me, it really comes down to 3 different aspects. So I would say first and foremost, the people. So the attendings are great. They're great teachers, great mentors. I like to think of them as great friends as well. You get to work with the students and residents. Co-fellows are great. And the staff too, again, I bring it back to it feels like a family environment, which is really nice. Second, I would say, is working at a county hospital. Taking care of a primarily underserved patient population, I think, is a real selling point and a point of pride for me. And then third, what is unique is obviously being in LA. It's a big urban cosmopolitan city, and there are definitely advantages to living here. Starting with the clinical side, you see a lot of patients in clinic and now over telemedicine as well. You get to see several consults per week, depending on the week. And you get more and more autonomy as you go along, including, you staff a lot of the patients for the residents and students, which is a really good experience. And then in terms of the educational didactics, that's also a great experience. So you have a very structured immunology curriculum. So you start with a 50,000-foot view of immunology, and then you go through a very scheduled, detailed approach to immunology so that you're ready for the boards and understand that in great detail. And then in between, interspersed with the immunology, you have regular reviews of common topics in allergy, which is very helpful as well. The majority of the patients at LA County that we see are primarily from the underserved population, which I think naturally everyone knows comes with its own inherent challenges. But I would really focus on it as an opportunity to really improve your own skills, whether that be in kind of building trust, building relationships with patients, working on your teaching skills, working on medication adherence, and trying to break down barriers. So I see it more as an opportunity, to be honest. And you get to see definitely a wide variety of different types of patients and diagnoses. So you see anything from infants all the way to adults. It's a nice mix, about 50-50 adult and pediatric patients. And personally, as someone who trained in internal medicine, I wanted to definitely see a lot of kids so that when I went out into the real world, I would be trained in both adult and pediatrics. And we do a great job at the balance. The workload for the fellowship program overall, I think it is very reasonable and good, to be honest. We stick to the ACGME recommendations for division of work in terms of clinical time and in terms of research and didactics. So you definitely see a lot of patients, but it's certainly not overwhelming, especially compared to residency. It's a much better balance and quality of life. And you get a little more time to really go in depth on those challenging patients because you're not overwhelmed with just pure clinical volume. So definitely a much better improvement. I think a lot of the more complex patients in our field would be those with immune deficiencies, whether that be kind of pediatrics and either primary immune deficiencies or genetic abnormalities, or even going up to adults who have, for example, CVID or combined variable immune deficiency on some sort of immune replacement. So those patients can be very complex and challenging. You also get very difficult to control patients with asthma that are on biologic therapies, and you manage all of that. So it's a very good experience. I would say that the program, you have quite a bit of autonomy, but it's a graduated responsibility. So you start off with a lot of supervision, and then once you display clinical competence for a certain area or a procedure, you get more and more autonomy in that. And eventually, you're supervising residents, students, and you're the one staffing, obviously with attending supervision. And they're always in clinic and there to answer questions, and they always are listening to the staffing and provide teaching points as well. So it's a very nice setup. LA is a huge, diverse, cosmopolitan city, great weather, great place to be, a lot of culture, a lot of good food. You can find pretty much anything within a 5-mile drive. It's great for being outdoors. You can be outdoors all year long for the most part, doing a lot of hiking, outdoor activities, going to the beach, you name it.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.